are seeing a late summer surge in COVID infections and hospitalizations, and some health officials are once again pushing for a return to masks, despite recent studies that suggest masking made no difference in transmission rates. Dr. Anthony Fauci was pressed on this over the weekend.
What about the studies that initially persuaded policymakers to impose mask mandates? They were convinced by non-randomized studies, flawed observational studies. How do we get beyond that finding of that particular review?
Yeah, but there are other studies, Michael, that show at an individual level for individual. When you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong.
Dr. Marty Makary joins us now. He's a professor of public health at Johns Hopkins University and a Fox News contributor. Doctor, thank you so much for being here. You know, I can just see folks listening and watching at home, hearing that it's possible that mask mandates or recommendations could come back. There's these studies that say that it really wasn't that effective. Fauci seems to have gone back and forth. What do you say on all this?
Well, first of all, the study that the interviewer is asking Dr. Fauci about is something called the Cochrane Review. It's a summary, comprehensive analysis of 150 studies on masks. It found that masks had no impact on community transmission. Now, it doesn't mean if you put two people into a room and they have very tight-fitting N95 masks for a brief 20-minute interaction that you're not going to reduce the risk of transmission. It's believed it does. But on a community level, when we tell the population, when we tell kids in schools, including toddlers, to wear masks, it had absolutely no impact on transmission. So Dr. Fauci did not refute the study. He didn't try to poke holes in it. He changed the subject. He created this arbitrary sort of delineation that there's individual masking and community masking, and individual may work and community may not. But we have spent a tremendous amount of energy and our time arguing over masking. It has an intervention that is essentially no benefit whatsoever, but we live in a new era of blind allegiance to certain public health officials, and that, I think, is the tragedy of it.
Yeah, I think over the course of the last few years, folks have decided that sometimes they just have to make their minds up for themselves. But Dr. Fauci did say he hopes that people follow recommendations. Now, those aren't requirements, but can you even imagine a scenario in which a mayor, the head of any kind of other municipality, a governor getting up and saying it's time to put those masks back on?
Well, generally, they read the tea leaves of public support, so I don't see it coming from government officials, except in certain states where masks are very popular, and people are reading their own narratives and rewriting their own history on COVID. Dr. Fauci is making some space between him and the CDC. He's been doing this a lot in the last 6 to 8 months, arguing that the CDC has their recommendations and he's simply supporting them, or, you know, that's them and that's not me. So we have seen that lately. My concern is now you have so-called experts that are citing conclusions in studies when they like those conclusions, even though those studies are flawed, and they completely ignore the studies like the Cochrane Review that give them results they don't want to hear, even though they have impeccably strong research methodology.
Yeah, I can see why you make that point. It's just that folks, I think, are just so doubtful these days, and it's really hard to decide what to do. And on that, can we just talk a little bit about this new variant, Parola? And we'll put up a map, and you can see where it's been detected. There are a handful of states that it has been detected in the United States. It is increasing in number when it comes to the number of patients. Can you tell us what it looks like, how it's different, what people should be doing, and what they should be concerned about?
I think they should consider this to be one of the many common respiratory viruses that circulates and is seasonal. Now, Parola, or BA.286, is incredibly different from the prior COVID variants. And that may mean that it's essentially cleaning the board, starting from scratch in its spread. It may not care if you have antibodies to one of the previous variants. But the laboratory data is suggesting that it's not more dangerous, it's not more pathogenic, and it's not more transmissible. That is, it does not have more infectivity. So we'll have to see. The Biden administration is about to push a brand new COVID booster that is a newly designed booster in about 8 days from now. They're going to recommend it for everybody age 12 and older with no human outcomes data. In a laboratory study that was done a few days ago, this new vaccine is shown to be non-effective against this new Corolla variant. So it likely has no impact whatsoever.
So, I mean, when folks hear this announcement, what should they do with it?
Look, I think people should demand to see human outcomes data before they take a novel vaccine that's been created with an accelerated FDA approval that has gone around the normal process. You actually had Biden say that the new COVID vaccine works and that it's necessary for everybody to get it before the FDA has even evaluated and approved it. So I would only recommend it for extreme high risk situations in people that don't have circulating antibodies.
Okay. Dr. Marty Makary from Johns Hopkins University, thank you so much for joining us. Anita?
Thanks.